All right, Shelley, thank you so much for being here today. Like, I already know that this is going to be a fantastic interview just because your expertise are fantastic. So,
Oh, thank
if we could just open up with you explaining a little bit about what you do to help mothers with medical trauma and why you came to this work.
Okay, gosh. So I've been doing counseling for about 20 years. That is that is just blows my mind to say. And then so I've been working with moms really since I became a mom myself. About 9 years ago, I have a 9-year-old son, a 6-year-old daughter, and in the process, since after having kids, I got certified in EMDR, and I've been working with moms utilizing EMDR to help with all of the bumps that happen along the way in the journey to and through motherhood.
What is EMDR, just for people that don't know? Because I know I was very
Yeah,
confused about what it was.
it stands for eye movement desensitization and reprocessing. So essentially what we're doing is there's different kind of therapy approaches. Some are top down like talk therapy. So you're staying very much in this like cognitive space. And then EMDR is a bottom up approach. So we're paying attention to the thoughts, the feelings, and the body sensations while we're going through a traumatic incident that we may not even have a full memory for.
Mm.
Gosh, I could go into so much there, but we use bilateral stimulation. So we use like eye movements, either back and forth or taps back and forth, or you can use audio back and forth or like visual, like a dot across the screen. Really just that bilateral stimulations. It impacts three different main areas of the brain, which then helps essentially the brain say, okay, we're going to open up this folder on this traumatic event, and we are going to bring in all of these areas of the brain that can interpret it, that can feel it, that can add reasoning, that can add insight, that can add adaptive information. And then we can be able to look at the traumatic event. And not that we want it to happen again and we're glad it happened, but this piece of, I'm okay. I'm okay now. I'm safe enough now. Or, wow, I'm good enough. It could be a variety of different positive beliefs about the self, but really, it's, I love it.
I did it myself, and I found it absolutely incredible. I was terrified to sort of obviously go.
Plus,
For someone who I was just so like, it's like hypnotism. I'm going to be like stuck in this vortex of
yeah.
re-experiencing, and it wasn't anything like that. And I came out of it feeling so much more aligned with kind of what happened. It was almost like it helped my emotional brain just move aside and let my rational brain step in and just look at it and be like, oh no, Kim, you like this was okay. Like we survived this. Like you're not reliving this. This isn't now, this is then. And sort of almost like talk myself down and calm that emotional side of my brain so that once the EMDR was over, that rational side of my brain was then more in control of my memories of that event rather than my emotional brain kind of like slamming into it every single time and then just exploding.
Yes.
Yeah, it was just sort of exactly what you said. You're just sort of like, I am enough. I am okay. This happened, and that is okay. It has helped me be the person I am today.
Hmm.
So I found it absolutely incredible because I found obviously when I do this work, I can talk about my trauma. I can really talk about my trauma. So talk therapy to me is a lot. I couldn't feel it.
Yes.
Verbalizing something is fine, but the EMDR really helped me feel everything that I needed to feel to get past it. So
Hmm.
I think EMDR is just absolutely fantastic. Absolutely fantastic. Thank
I'm
you for
so,
doing that work.
oh, I mean, I love it and I'm blown away every day and I get chills and especially like that first time somebody doing it,
Mm,
they're like, oh my gosh, like what was that? And I'm like, I know, it's like
yes.
magic. I know. Yeah. Hmm.
That's absolutely awesome. Yeah, I with the mothers, because you do a lot of work with the mothers that have medical trauma as well.
Hmm.
Can you
Hmm.
speak a little bit about that and how that kind of came about and why it's not really spoken about, to be honest? Medical trauma is not something that mothers are overly aware of.
I mean, when you think about it, the act of either even trying to get pregnant or once you become pregnant, all of a sudden there's this process that's happening within your body that is very different than any other process that we've been through. And that for people who, gosh, I mean, have a history of trauma, that can be very traumatizing in and of itself. Even if they're like, I planned for this pregnancy, this baby, I wanted, this, but oh my gosh, it's like, it's opening up maybe some of the trauma from my own childhood because pregnancy is so, it's like all of the things all at once. It's your body, it's your thoughts, it's your feelings. But it really, I think, opens up this piece of vulnerability, and especially vulnerability with your body. Because, for example, with preeclampsia, no one decides, oh, I would like to have preeclampsia with this pregnancy. There's a lot you can do to try to be healthy, but still, sometimes those things happen. And so oh, go ahead.
What is pre-eclampsia?
Well, it's something that can happen in pregnancy, which is usually diagnosed after 20 weeks.
Mm.
And there's a lot of different indicating factors, but usually there's high blood pressure associated. And essentially, it's about the placenta at the time of implantation that something didn't quite go correct and go right. And so women begin to spill protein in their urine and gosh, a lot of different symptoms like swelling, vision changes. But the high blood pressure is usually a big piece of indicating that you have this. And it when that happens, women and a lot of the things that happen in pregnancy, you're in a place where your body is not like you're not really in control of your body. And I think that that's something that women have to grapple with in a different way once you're pregnant, that wow, okay, I'm not actually in control over what is happening. And if you've had past trauma too, that can just light that on fire.
Yeah,
Mhm.
yeah, of course. Yeah, that out of control of your body seems to be a huge thing with trauma. It's sort of just like that loss of all control.
Mhm.
When I, just because I was a child patient, and as you know,
Mhm.
like I had a lot of experiences with my own mother while I was in hospital, and my experiences with my mother and how I saw her as a 4-year old while we were in hospital and I was having my surgery had a huge impact on how my relationship developed with my mother. And she was obviously under a lot of stress during that time when she was watching me having all these surgeries and everything like that, a lot of stress. And I know consciously that she was there and she loved me and she adored me. But because of the experience that I was going through and the pain that I was going through, I computed it that she was actually giving me to doctors to hurt me,
Yeah.
and it was a betrayal. And the stress and the pain on her face made me or caused me to believe or compute that if I wasn't okay, then she wasn't okay. So that meant
Mhm.
I always had to be okay. I always
Yeah.
had to be the strong one. And I'm just wondering if there's any sort of advice or there's anything that mothers can do to kind of like regulate their emotional system when they've got children in hospital, or if they've got their own past trauma that could help their sort of child development.
It's gosh, it's so hard because one, if we bring it out a little bit bigger, the system is broken. At least, especially here in the United States, the system is broken, and so we have a system that is not set up and aware to help mothers, to help children, to help even the providers and the doctors and the nurses, and so it's so hard because in that moment, I'm thinking, a child, it makes so much sense that when you share your experience, that as a child, you knew at some level, I have to be okay, so she's okay. Because essentially, as a child, your your lifeline is your mother. Your lifeline is that. So it is, kids will, sacrifice themselves left and right in order to make sure that their parent is okay. And so, and as parents, as mothers, especially in this, that I mean, as you talk about your mother as well, you you know that she loved you. You know that. But in that moment, you're getting that message that she's sending, not intending to, and you're picking up on the only thing, okay, is this something I can control? So maybe I can mask. I can be okay. I can like not complain as much. I can keep it in. And moms in those moments, it's so important that we want to reach out for support because this is not anything that we're meant to do or can do alone. And also, I think some of this piece of, gosh, just simple things like connecting with the breath, being able to remind yourself and doing these things even with your child, if they're in these kind of situations, you can do these things with them. Just a simple making the exhale longer than the inhale, that can be one of the most grounding things that we can do. And so if you're a parent in this situation and you're going to be, entering the room with your child or um, in this kind of medical setting, okay, practice some of these deep breaths in through the nose, out through the mouth, making that exhale longer than the inhale. I think that's a good place to start, um, because then you're sending to your nervous system, okay, we can relax right now, and then that's going to help your face. That's going to help your interactions with your kids. It's a good place to start.
I think that's a really poignant thing that you said, that actually if you are in that situation and you are in the hospital with your child, and that you do need to, and you are feeling that stress and everything and like that, actually taking the time to do that practice with your child. Because I think from my side, that separation, that not knowing, that seeing my
Yes.
mother under stress, but her not almost admitting to it, or not
Yes.
telling me, or sort of reassuring me that it's okay that she's scared, that it wasn't actually my fault. And if I think if we'd done kind of like a breathing exercise or something along those lines, where we came together and we were just able to be scared or anxious together,
Yes.
that I think would have made a huge difference, just to the way that I was computing it. Because obviously I was terrified as a child, but I
Yes.
knew that my terror hurt my mum.
Yeah.
So it's it's such a complicated connection between mothers and children. I think it's so complicated.
Mhm.
Are you able to sort of explain a little bit about the biology of kind of like what's happening with the mother's nervous system
Mm.
when their child is sort of in surgery and in pain? Because I think it's so important for mothers to understand that it's a biological thing. Like, I
Absolutely.
know it's not my mum's fault that all of this stuff
Yes.
imprinted on me as a child. It's, but it is, just understanding that I think would be so helpful.
Absolutely. I think this piece of, I almost look at it as if a trauma is happening to your child. So, in this case, a medical trauma happening to your child, as a mother, to a great extent, that is happening to you too. And so, we know, just biologically speaking, the sympathetic nervous system is going to kick out all of this adrenaline. And when that happens, it is going to knock off this prefrontal cortex, which is, we have this online and it's really not developed until you're, don't quote me, I want to say 25. Um, but this piece of this rational brain that's able to offer logic, reason, decision making, um, that goes offline. The adrenaline just kicks that offline. And so in that moment, you're in this fight or flight or freeze or fawn moment where your amygdala is on high alert and it's ready to act, it's ready to do. And most of the time, that acting, unless there's like literally a bear in the room, well, and even sometimes a bear, is to escape, is to flee. So our natural biological driven need in that moment is to, oh my gosh, get away from the trauma. And when the trauma is happening to your child, this can create such conflict within the mother because it's like you're biologically, your system is like, get away, get away. This is, put up a guardrail here. But you're also like, this is my child. And so it's very, very complicated, but it's not, gosh, when that happens, just being aware as a mom that when that happens, it's not your fault. Mhm.
Yeah. I think that's a huge point to make, that it really isn't your fault. When I
Mhm.
spoke to my mum about this whole episode, like when I was in hospital,
Mhm.
she said to me that she was just like, there was one moment that you asked me when you woke up, could I be there?
Mhm.
And she was like, I regret it to this day that I didn't do that. In the moment, I felt like I couldn't do that. Like it was just too much. Like I
Yes.
was already there all day and everything like that. And she was just like, I just couldn't do it. And she was like, I regret that to this day because the fact that you asked me specifically to be there when you woke up and I couldn't do that. She's like, I think that had a big impact. And I actually, once she sort of said that to me, I was just like, you know what, I think that might have done as well because it was sort of that ask of this huge like emotional
Yes.
roller coaster that we were both on. And I think maybe at that time I just needed that reassurance of like, especially when you wake up as a child in the ward and you're on your own, you're surrounded by strangers. That's the first thing my memory had in the morning, even though I had nurses and everything like that, that I obviously recognized. It's not the same as your mother being there. So, but yeah, and I wanted to share that because I think that's important for other mothers to hear. Because,
Absolutely.
yeah, for it's, there's just there's moments of sort of being a child, and I know that there's a lot of pressure for mothers to protect their child from what's going on, to
Hmm.
just protect them,
Hmm.
to like keep everything from them.
Yes.
Um, and I think it's, from my point of view, I think there is a grey area, and I think it's the wrong thing to do to keep everything from that child. Because I think we
Absolutely.
need to remember that what they're going through is an adult experience. It is not a child's experience.
Yes. And that made, I love that because think about, I mean, even as you describe that, and you were saying, as you told your mom, and you were talking about this, as an adult, and she said that she regrets that and that she was sorry that she didn't do that. That is so healing. So I also want moms to hear that too, is that we as moms are not always going to do it right. There are going to be things I'm sure that I'm doing as a mom or have done that my kids are going to be talking about in therapy one day because we're human.
Yes.
But anytime that we can go back and we can work on that repairing and we can say, you know what, I regret this. Like, mommy regrets this. Even now, when my kids are young, being able to say, you know what, I didn't handle that very well. I yelled at you in that moment, and you were really overwhelmed by your feelings. And I'm very sorry. Mommy makes mistakes sometimes. What can I do next time that will help you when, that happens? So there is all is not lost if this has happened. There's repairing that can be done. And this is why we need someone also supporting mom as she's supporting her child, because mom needed that so she could be there for you.
Yeah, 100%. And I think that's something that has come up over the years of healing with my mum about this whole situation is how mothers are sort of, there's a societal pressure for mothers to keep it all together, to sort of be strong for their child. Almost not that emotions are dirty things, but emotions are gonna cloud the situation. And I think also for women especially, we're always taught to be sort of like, don't be so emotional. And I know in England it's very much sort of just like, suck it up, buttercup. And I think that
Mhm.
that did not help my mother. That did not help her at all because she
No.
had to internalize a lot of her pain and struggle. She didn't know that she could look for help. And it also taught me that I should do the same thing to save from causing pain to my loved ones. And I think there's that sort of passing on of not bad habits, or just sort of like that fear of our emotions. That's a
Mhm.
stigma and a societal pressure that I think needs to be broken, especially when mothers are dealing with such a high pressure, high emotional situation with their
Mhm.
child. Um, it's it's crazy to me that we still have that stigma. And I was just wondering what you would tell a mother who is sort of battling with that kind of like, I have to keep it together.
Yes. It's so interesting because as you were saying that, it made me think, gosh, that this idea of this hysterical woman with this emotional expression, it is really, let's be honest, overwhelming to white men.
Yes.
That is the history of it. That is there. I mean, it goes back and probably even before Freud. But we get that message, and even like in our, gosh, well, in our culture and our DNA as women, don't be hysterical. Don't, and it's like, we we're told to disconnect. We're told that's how you handle it. That's how you move on. And that couldn't be anything further from the truth.
So it was more sort of to do with like, it was just what you would want a woman who is struggling in that situation, a mother who is struggling in that situation, to know, and sort of almost to know, and almost it's kind of like giving that permission to not be okay, and sort of what she could do, and just like if there's any sort of like support places, or it's medical trauma is just so not spoken about. It's so hard to be like, yes, you can go here for the help, because actually doctors and nurses aren't even taught about that.
No, we talk about people that really need the support because they see it every day.
Yeah.
So with that, I mean, I would say the biggest piece is really about finding a community. And I know one which you're familiar with.
Yes.
Medical support, medical trauma support out of Texas offers a wonderful community to be able to help with this. And then I think it's about getting a therapist who understands medical trauma. So when you are doing a consultation with a therapist to see, okay, is this going to be a good fit? Or, looking on their website, you want things like medical trauma to be mentioned. And then ask them directly, what are your thoughts on this? How do you treat that? Of course, I'm a proponent with EMDR. I mean, that's my modality, but I think it's about finding a community. And then the other piece is about getting your own work. Because a lot of times what is happening as a mother who's dealing with a child in a medically traumatic situation is what we would say with EMDR, these negative cognitions, these negative beliefs about themselves are getting just triggered wide open. Like, I can't stand it or handle it. I'm not a good mother. I'm powerless or helpless. I'm not in control. Also guilt and shame. I did something wrong to cause this for my child. It's my fault. And so really being able to dive deep into those things can really help provide insight and support and healing for moms that are supporting their child.
Yeah, it's heartbreaking to me. Whew, sorry, talking about my mum. That exactly what you just said, that guilt and shame of kind of what did I do to do this to my child? When I was a kid, they didn't discover that I had double hip dysplasia until I was 4, even though I walked like Charlie Chaplin with my feet like this. And my younger brother was born with dyslexia and dyspraxia, and he had a lot of sort of mental difficulties. And when I developed sort of this walk, my mum went back and forth to the doctor several times, and they actually told her that I was just being silly. And it was only once one GP sort of like clicked to what was happening that they did these x-rays, and they were just like, we're so sorry. I'm so sorry this is happening to you. And my mum sat there with me and said, oh my God, but she's my normal one. And that pain and that shame that she felt, that she now had 2 children that were, me and my brother, basically Thunderbirds, like not put together very well, but she's carried that, she had to deal with that. And there's nothing there to help her through that.
No, I mean, because that idea, like, what did I do wrong to cause this comes up a lot in my work. Gosh, was it a medication I took when I was pregnant? Was it something I ate? Did I not, exercise enough? Did I, was I working at a stressful job? That piece. But, I think about for your mom, that moment is very poignant for her. That's when medical trauma started, I would imagine, unless there's more of a history. But when she was taking, doctors and being like, okay, I know something's wrong, like we need to, and being told, oh, she's just being silly.
Yeah.
That, for a mother, that's traumatic. Because you know your child.
100%. And I think that's a huge message to mothers right now, because I've spoken to several now who've had this experience of taking their child to the doctors and being told over and over and over again, no, she's fine. Just take her home. She's really healthy. She's fine. Just take her home. And it's not just me. There's been several women that have come and I've interviewed, that have had to battle for years. I had one woman whose daughter had a 27-inch tumor in her chest, and it took them 6 years to have a doctor actually go, okay, we'll actually do tests.
Wow.
The rest of them were, she has anxiety, she has gas, she's just being over. Yeah, they medicated her, but they refused to do the tests. And now she deals with now PTSD from medical trauma because of this experience.
Yes. Because you're at some of the most vulnerable that you can be, and you're asking for help, and nobody is stepping in, nobody is there. And that, I mean, gosh, what a pain that creates. Yeah.
Do you think if medical trauma was more spoken about and there was more awareness of it, and we actually sort of we gave this information to parents and child patients when they're actually in the hospital, and gave these tools to them at that point, not to scare them, but just to give them these tools at that moment, do you think that that could really help sort of reduce long-term mental health issues within society?
Absolutely. I mean, you think about it just in the basic sense. When you go to, gosh, a doctor, and your yearly appointment, if that nurse or that doctor is calm and is helping you talk about something, that's mundane, like, oh, what are you going to make for dinner tonight? Or is really saying, hey, I've got you. Like, I know you're, anxious about this and worried about this. This is what I'm going to do. This is how I'm going to be here with you.
Yeah.
And you tell me you're in control. I will only do certain things when, you say that it's okay. Like, to have a provider who can step in and do that. One, they have to have a system that supports that. It gives them enough time with patients to do this kind of nervous system regulating work.
Yeah.
It's really about like being able to have that co-regulating space. And so it starts with the system, and then trickles down to the provider, and then the parents, and then the kids. So it's system-wide changes are needed. Yeah. But oftentimes in doing reprocessing, a mom might bring up a nurturing figure, which we'll spend some time with, and it can be real or imagined. But for some of them, it can be that nurse that attended their birth, that held their hand the whole time. It can also be a mother figure that they wish that they would have had. And so, gosh, being able to incorporate so many of these resources, if this could be done in a comprehensive way in part of the system so that we could support people better, this would not only help physical health outcomes, this would help mental health outcomes. This would save money. Like, it's
the ripple effect. Yeah, exactly. The ripple effect through the whole of society, through the economy, through everything. Yeah, because it starts with the core. Like, it starts with the problem before it goes off. And it's something that while I've been sort of trying to bring light to this and sort of share my experiences so that other people can sort of see it, it's the way that I've been explaining it is like, for parents, it's like preparing for the bomb that might go off. It may never, ever go off. You may never have a child that has any traumatic experiences, but knowing that it could will help prepare you if it does. Because I know that my parents had absolutely no idea what was happening to me and why I just suddenly just blew up. And
yeah, if this could be a part of something preventative that we do, this is what I always tell moms, or even, a lot of people will work with me around like just the fear of giving birth, and I've never done it before. Okay, it's like, let's look at what could be being triggered in this experience, and let's work on our stuff as moms, so then we can step in and our stuff isn't going to bleed out on our kids. Like, that is so important, because I would think most people go through something traumatic. It can be something big, it can be something little, a combination of things. I almost say when your child goes through something traumatic, it is. We don't grow up in a bubble, right?
Exactly. And actually through research, I actually found a paper that suggested that women were actually 2 times more likely to develop PTSD symptoms from medical surgery and stuff like that, because we more than likely carry previous trauma from assault, from childhood, from sexual abuse, than men do. And that's a huge thing that just people just do not talk about. And it's also the women that haven't come forwards to be like, this happened to me.
Yes.
So they could be even carrying it without even saying it. And it's something that I've had to deal with my mother, and we'd had to work through that. She actually carries a lot of generational trauma that sort of trickles down. And it's such a huge thing for a mother to go through with birth and everything like that. And I think it's amazing that you go, okay, so you're scared of being pregnant, but where does that come from?
Yeah.
And I think that's the key of just like, maybe it's not this moment that you're terrified of. It's actually triggering all of this other stuff that's been mounting up for years that just you never faced. I think that was just an amazing thing you said there.
Well, the way I look at trauma, the longer I do this, the big kind of buzzword is like, okay, complex PTSD.
Yeah.
And I'm kind of like, who doesn't have complex PTSD that has PTSD? It's all complex. These unicorns that exist where there's been one isolated traumatic event in your life, first of all, I kind of don't believe it.
Yeah.
It's all complex.
Is the thing. I think that one major event might be the catalyst,
but
it's not sort of the cause. Like in writing my book, it's sort of like all of these little traumatic events that came out. Like my childhood surgery was like obviously the catalyst for me, but then there's a behavioral pattern that develops in me because of that one catalyst that makes me relive my trauma for the next 30 years and repeat it and put myself back into the hospital. So that's how my complex, it's sort of just like there's all of these tiny little things that I would have never for a moment thought was actually impacting this PTSD, like a bike accident that put me back in hospital. I would have never even thought, oh, this is now compiling. And it's incredible. Trauma is just the most insane thing, and how your brain works and how it computes and everything like that. I think we're just not taught to do self-reflection. It's just sort of like you get up in the day, you survive your day, and then, that's good.
Yeah. It's that piece of, I hope we're getting better at it, or at least awareness is happening, that self-care is not this, you eat chocolates and take a bubble bath. Self-care is like the stretching you do every day, the meditation, the moment of practicing that exhale longer than the inhale. Feeling the sun on you and really soaking that in. And then with EMDR, we would do slow taps to just strengthen that. Yeah. So that your nervous system is like, ooh, pay attention to this. This is good.
Yeah. The self-care sort of reflection that I sort of teach through my practice is actually because of that separation that women have in surgery, that sort of cut with that relationship with their bodies, is actually self-care is rebuilding a loving relationship between your mind and your body and yourself. And the meditation, the tapping helps you go from your skin inside and spend time having coffee or just sitting next to that other woman that's inside you, the one that is that vulnerable side, and having conversation and just working through things that are sort of bugging you or keep coming up and stuff like that. That's how I kind of always think about this kind of self-reflection and healing. I know that you do a lot of healing work with mothers with medical trauma. What does that kind of look like? What kind of mother, not expect, because healing is different for everybody, but sort of like, what is the difference between a mother who does just suck it up and somebody that does actually find healing? How does that benefit not just her, but her families, her children, everything like that?
Gosh, it looks like you had really pointed out that ripple effect. I actually say it all the time with moms I work with, is that we work on our stuff so that we don't bleed out on our kids, because our trauma, and really, we all have some level. If left unchecked, if left unsutured, if left uncleaned out, left with a healing ointment on it, it is going to continue to fester and then to get yuckier and just go out everywhere. So somebody who is working on their medical trauma, It is also about that piece of establishing that relationship with your thoughts, your feelings, and your body, and really getting attuned to looking introspectively within yourself, identifying parts of yourself that hold things, that hold moments. Maybe for a lot of my moms, there's a younger part, which usually is about some of that younger childhood trauma.
Yeah.
And you'll see that so often. Oftentimes, the age that their child is, if it's the same age at which they had a traumatic event, it can be very triggering to see your child in that age. So it's people that are working through that, I think, are making space for it. And there's this intentional process with it. And I mean, and there's highs and lows. Healing is not linear. It's just up and down.
Yeah. 3 steps forward and 8 steps back sometimes.
Yes, 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 yeah.
I have absolutely loved speaking to you today. I think this has just been wonderful. And I think any mothers listening are gonna hopefully just feel a lot more peace about the stress that they might be going through right now. I just wanted to close this off by asking you if there is one thing that you wish every mother knew about themselves when their child is going through hospital, that you just to reassure them or just to help them in that moment to know that it's not their fault.
Oh gosh, I mean that's the first thing. And and I love EMDR because it helps us go deeper. Because I can tell them all of these things, but we want them to be able to really feel that for themselves. And with EMDR, you do. But I mean, what I would say is, yes, it is not your fault. There's nothing that you did wrong. This does not mean that you're a bad mom. It does not mean that you're a bad mom if there's moments that you haven't handled well. You can always repair and connect with your child, even in the midst of the difficult traumatic event happening. It's never too late. Um, and I would say too that moms are their greatest resource, and they're the greatest resource for their children. Like you said, with waking up from a surgery, and it was great that you knew some of the nurses, but there's nothing like your mom.
Yeah.
So you are that regulating piece that your child looks for and needs that attunement with. And so in order to do that, take care of yourself. Because I mean you're the most precious thing.
Yeah,
Mhm.
that's wonderful. Thank you so, so much for that, Shelley. And thank you so much for your time today. I cannot thank you enough. This has just been
Absolutely.
wonderful.
Thank you.